Hi, I'm Sarah. We're going to be going over all of your discharge instructions for after your transplant. This will be a summary of everything you need to know. But don't worry, you're not going to be doing this alone. Leaving the hospital after transplant might make you a little nervous, but once you have a transplant, you're part of our family forever. The nurses and the coordinators will give you all of our contact information, and the transplant team is available 24/7. The phone number for the transplant office is 551-996-2608. During standard business hours, this will bring you to the transplant office. After hours, there's always an answering service on call. Remember, the number is 551-996-2608. Now let's talk about your daily routine at home. There are a few new things you're going to be learning, but don't worry, it's not as scary as it seems. The nurses and the coordinators are going to be preparing you for home and get you ready with all the supplies that you need. They're going to be giving you a goodie bag of everything that you need to take your blood pressure, your daily weight, and everything we'll be talking about. First, let's talk about what you do when you wake up. When you wake up in the morning, you're going to be taking your daily weight. Daily weight is especially important if you had a kidney transplant. This number helps the surgeons and the team measure how healthy the kidney is. We're going to be supplying you with a scale. We recommend that you take your weight right when you wake up, before you eat anything. You're going to want to compare the number to yesterday's number. Call the transplant office if your weight today is 5 pounds or more than yesterday. After you check your daily weight, you're going to be checking your vital signs. What I mean by vital signs is your temperature and your blood pressure. Check your temperature under your tongue and call the transplant office if it's greater than 101, and then check your blood pressure. You're going to be doing your blood pressure before breakfast and before dinner. Now a good question is, where do you write all of this information? Your nurse will be giving you a daily log where you're going to record your temperature and your blood pressure. If you had a kidney transplant, the doctor might want you to monitor your urine at home. Sometimes the kidney could be a little sleepy. The doctor will let you know when you can stop monitoring your urine, when your kidney wakes up. On this daily log, there's also a spot for monitoring how much water you drink. The transplant team will be providing you with a Hackensack Meridian Health water bottle, and you can write down how many water bottles you drink a day. The doctor will tell you exactly how many to drink each day. Now I know this might be new for you since maybe you were on dialysis and you weren't drinking much before, but after transplant, things are different and it's very important to stay hydrated. All of these instructions will be reviewed in person by your nurse and your coordinator before you go home. Immediately after the transplant, we're also going to ask you to take a look at your incision when you're home. Your incision typically has a clear glue over it. This is waterproof and doesn't require a dressing, so you don't have to do any extra care at home. All you're going to do is take a look at the incision every morning. If there's any swelling, tenderness, increased pain, or any green drainage, you're going to call the transplant office and let them know. Remember, the phone number is 551-996-2608. You can shower after the surgery, just no baths or swimming for 2 weeks. After your transplant, it's very important to stay healthy, so please avoid anyone who's been ill for 2 weeks after the surgery. It's also really important to wash your hands. Wash your hands with soap and water prior to eating and prior to taking your medications. And when you go out in public, bring some sort of alcohol-based hand cleanser with you so you can wash your hands while you're out. But don't worry, you don't have to wear a mask. One of the most frequently asked questions we get is, when is it okay to call the transplant team? Let's clarify. It's always okay to call us. Remember, you're part of our family now. But here are some examples of when you would call us. If you have any shaking or chills with or without fever, new or persistent cough, pain that's unrelieved by your medication, burning in your urine, blood in your urine, diarrhea that's lasted for more than a day, and persistent nausea or vomiting, especially if it's preventing you from taking your medications. If you have any sores or white patches on your lips or in your mouth, if they're preventing you from swallowing, you have to let us know. But especially if you go to any other doctor and they change any of your medications, please let us know right away. Let's talk about your diet after transplant. Immediately after transplant, there might still be some dietary restrictions, but typically you're going to end up on a regular diet in no time. Your transplant team will let you know when this happens. You're going to be seen by a registered dietitian in the hospital and once you're home. The dietitian will give you all of these specific instructions for you individually. But here are some things that you might have to look out for. You might have to still decrease your potassium at home. Don't forget, foods that are high in potassium are things like potatoes, spinach, bananas, and tomatoes. You may need to increase your phosphorus and your magnesium. Foods that are high in phosphorus are things such as meat, dairy, and cheese. Magnesium-containing foods are things like brown rice, dark chocolate, and fish. Your registered dietitian and your nurse will go over specific instructions for you before you go home. But wait, all transplants must avoid grapefruit, grapefruit juice, pomegranates, and pomegranate juice. They interact with your medications. First, let's talk about driving. No driving immediately after the transplant. You're going to be too tired and in too much pain, so don't start driving until cleared by your doctor and until you're off all pain medication. Even though you're not allowed to drive immediately after your transplant, starting to resume activity is a good thing. It's important to have an active lifestyle, so if you didn't have one already, start to include some more active things into your day. Walking is really important for your post-surgical health. Stairs are a really good exercise too. However, no heavy lifting, so nothing over 10 pounds for 2 weeks. If you like high-contact sports or anything of a more strenuous activity, that has to wait 8 weeks. But clarify with your doctor of the specific activity that you like to do. Increasing your activity is not only good for your physical health, but also for your mental health. It's normal to feel a wide range of emotions after transplant. This is life-changing, and we're here to support you. Please talk to your team about what you're feeling. This is a journey that we're all on together. Another lifestyle tip is no smoking after transplant. There are support services available to help you quit if you smoked prior. Just let us know. Now, if you're of childbearing age, it's important to know that females should avoid pregnancy 1 to 2 years after transplant. We're more than happy to plan this happy life moment with you. We just want to make sure the time is right. So if you're thinking of having a baby, discuss it with your provider. Now let's talk about returning to work. Typically, patients will return to work after 3 months, sometimes as early as 6 weeks, depending on how you feel and depending on what you do. We'll figure it out together. After transplant, the medications you're taking can make you more susceptible to skin cancers. Because of that, we recommend that you wear SPF 50 when you're out in the sun and have some kind of hat or umbrella to block you. The most important lifestyle tip after transplant is see your doctors. We're going to be making a schedule for you to follow up with the transplant team immediately after your transplant. Typically it's twice a week, but the further out from your transplant you get, the less we need to see you. Just follow the schedule closely. And don't forget, if you have any questions, you can always call us at 551-996-2608.